Greetings from Penn State Health and the Milton S. Hershey Medical Center in Hershey, Pennsylvania. Penn State Health is hosting this patient panel discussion on the topic of infertility. This is a collaborative project between the divisions of reproductive endocrinology and infertility and hematology oncology, and this coincides with Resolve's National Infertility Awareness Week, as well as Adolescent and Young Adult Oncology Awareness, which was the first week in April. This patient-centered webinar consists of AYA panelists who were treated here. Jill Robertson, who is myself. I'm the Pediatric Oncology Psychosocial Program Coordinator, and I'll be the primary facilitator with the support of Dr. Pooja Rao, who is the Pediatric Hematology Oncology and AYA Director here, and Dr. Stephanie Estes, who is the Fertility Specialist and Professor, Division of Reproductive Endocrinology and Infertility. This will be a patient-driven discussion on topics related to their personal experiences as they were diagnosed with a cancer or a blood disorder, and were informed that their treatments will likely cause infertility. These are their stories of navigating two healthcare crises simultaneously. I'd like to take a moment to thank Four Diamonds and the Penn State Health System for their support of this program, and I'd like to take a moment to introduce our patient panelists. First, we have Corene Parrish. She's a 31-year-old nurse with a history of working HEMOC and bone marrow transplant for 5 years at the Children's Hospital of Philadelphia. For the past 3 years, she's been working at Penn State Health in the maternal child float pool. She is currently in nurse practitioner school to become a pediatric oncology nurse practitioner. She's in a committed long-term relationship and is currently undergoing fertility treatments. Joe Apgar is a 38-year-old CEO of Pelotonia. It's an organization built on a community that is passionate about ending cancer. 100% of all participant-raised funds go towards innovative cancer research at a school we won't mention, Ohio State. Since 2008, the RIDE community has raised more than $258 million. Joe is married and has a 5-year-old daughter. And we also have Bemi, and I'm sorry, Bemi, I don't want to try to pronounce your given name, but Bemi is an 18-year-old second-year student at Lebanon Valley College in Annville, Pennsylvania. She's enrolled in the BSN program, and after graduation, she plans to work as a pediatric nurse and continue schooling to eventually become a nurse practitioner. If everyone on the panel would like to tell us a little bit about yourself, what made you interested in participating in this panel, and any key points you'd like to convey during the webinar.
Not only as a survivor, but also as someone who at this point in their life is considering expanding their family. And I just find it really important to raise awareness for not only pediatric oncology and survivorship, but also infertility, because I think that for especially my age in my 30s, I do think that there's a lot more people that have infertility issues than you may realize. And I don't want to say that there's a stigma, but I think that as a woman, there is this feeling where if there is something that may be wrong with you, or there is like a complication that you may need assistance with, that it really can just impact your mental and physical well-being. And I just think that it's really important to not have anyone feel alone in that.
So I'm Joe. I live in Columbus, Ohio, as was mentioned by the Ohio State shout out, but I'm a very proud Penn State alum, and I assure you I still wear all my Penn State gear here over in Ohio. Died cancer when I was 21, when I was in college, diagnosed, and shortly thereafter learned about my own infertility, and sort of navigating that as a male has been really interesting. I think it's definitely a taboo topic and not something a lot of men talk about. So the chance to share my experience and share my story with all of you, and sort of admire all the work you're doing. And so I'm super excited to be a part of this.
Hi, everyone. I'm Bemi. So I'm a sickle cell patient, and I've always had it as I was born with it based off my parents' genotype. My brother and I were the lucky ones to get the SC genotype. As an 18-year-old and a nursing student, I am also still learning about how sickle cell can someday affect my fertility when I plan on having kids. So yeah.
I just would like to start out also with a question about when you were going through your treatment and the challenges that you've been going through and facing while you were either here or even afterwards going through reproductive treatment, what would you wish you would have known that you were going to face that you didn't know?
Obviously, like, you have to grow up very like fast when that happens at that age. And I wish I would have taken a second to just like think about how this could have impacted my future. Because when the time did come for like questions about fertility, it kind of like I felt like I was like hit by a train. Like it was like, this is all happening. And I think one thing about dealing with multiple parts of a diagnosis is that you kind of go through this mindset where you hope for the best and you expect the worst. But then when the worst does come, or it's like not something you were anticipating, it really just, you're never truly prepared for it. And I think that I wish that like 16-year-old me would have taken more seriously like thoughts about that in my future.
If you think about maturity at 16
Yeah.
years old, it's hard to have that foresight, no matter how many people might have been talking to you about it.
You know, when you go through a diagnosis of any kind, whether it's, cancer, any other disease, you're so focused on that disease and that sort of your treatment for that, and all the other things become sort of secondary. And it's also in certain settings, in office settings, or all the tens of people that are involved in your treatment, from different nurses, different sort of social workers, all these things. Everyone's really focused on your primary disease and getting you healthy from that standpoint. And so fertility, when I was 21 and I was a man, was a very secondary conversation. And a lot of the conversations I had about it were very sort of end of the meeting, or sort of just FYI, FYI. I'll never forget my first call, after I did the testing, which, hopefully we can talk about that process too. But, she just said, FYI, there was no detectable sperm. And I was, so, what's that mean? And she said, it means you probably won't be able to have children. But, if you have any questions, just call us. And, there's no education around it. I didn't, going to the internet, as everybody knows, when you go through any disease diagnosis, is the worst thing to do. And so I think just, I wish I knew the ways to get educated properly about it, or the resources that existed. Because I think a lot of those resources, and anything in sort of AYA, a lot of places don't have full programs, and so services become very secondary, and they're not the front of anyone's mind. And I wish I knew sort of the resource to go to where I could just sit down with someone and have them explain to me how to read tests and how to, interpret things that I was hearing, because it was the first time in my life I had heard those words. And so it's just a real education curve that exists there for people. And most people don't need to know a lot about it until you want to pursue a family.
I think I hear between the two of you a common thread is like, I wish there would have been some breathing room between being diagnosed and being told, in the future, if you want a family, these are things that might happen. And just some time to mull those points over. I mean, those are big things in everybody's lives. And you're being asked to address them in sometimes as little as a day.
And also fertility things like really complicated. And so there's like what you're saying, Joe, is that there's not really like a step-by-step playbook that you have that you can say, okay, do this, or that this is what it means, because it's a broad range of how egg and sperm work together, and those things come up, and it's not something you can just have maybe a definitive answer to.
Yeah, and so we talked a little bit about what you remember about the initial conversation, although Bemi, I'm going to give you a chance to speak as well about the unique challenges for sickle cell patients.
Unlike the other two panelists, I was able to have a conversation with my doctor about planning to have a family in the future, but I never really took it seriously because I was still younger than I am right now. But I now come to the understanding that with like sickle cell patients, especially women, and we have a reduced we have we have a lower chance of being able to conceive because of like the differences in our amount of amount of eggs that we have and stuff like that. I'm so sorry. And also too, it's only recently I came to the awareness that when I plan on having a family, I need to look for someone who doesn't carry the same blood genotype as I have, because then we are at a higher risk of passing sickle cell um, anemia onto our offspring. So for sickle cell patients, there's like a challenge in like, it's gonna be so weird for me when I plan on getting married, having to tell my future spouse that, hey, we need to test your blood genotype because you can't have A, C, or AS, you have to be AA. So we have a lower risk of complicating our future children's life.
And I think that's an important point. That's great to hear that you're thinking about that. So thank you. And there continues to be an evolution of technology. I think that's one of the reasons for this webinar is we can look at some maybe of the embryos that might be able to be created for someone with sickle cell, so that you can have children with a certain type of partner, but yet not have an affected child. So there's lots of new things out there, and we'd love to discuss that further with anyone who has questions in that regard. So thanks for bringing up that important topic.
I feel like in listening to your responses, one of the things that I wanted to ask is, in what ways would you have felt more supported by your medical team when you learned of the possibilities of fertility challenges? And I think what I heard is that a little bit more time spent, and a little bit more medical descriptions. I don't know. Let me just have you jump in and let us know.
So much gets thrown at you in the moment, and you have no knowledge base of anything that's being talked about to you. And so, you're sort of listening for, information about your treatment or, your surgery, or, I think a lot of people, especially at a young age, you're wondering, are you gonna die? I thought, am I gonna make it to graduation? Do I have to drop out of school? That was like the very first thing I remember thinking. And so you start to add these layers of a conversation on, and fertility makes its way into the conversation, and it's just misaligned with where you are in your life at sometimes. And so like I wanted to make it to graduation, and the only thing stopping me from making it to graduation was going to be my treatment. And if I had to drop out of school or not, like my infertility or fertility had nothing to do with me graduating. And so I also made it secondary as well. And I wish somebody, and probably somebody maybe other than my oncologist, like another resource would have sat down and said, hey, I just want you to know what this means. And I want you to know that these are all the different paths that exist. And it's disappointing news, and it's okay to be disappointed, but there's also like many ways to make a family. Because I actually didn't feel sad about it for a while, because I didn't know to feel sad about it. Or sort of that I never felt like a loss about it in the moment. I felt a loss about it sort of after, sort of reflecting on the experience later. And so, to have a resource that would have sat down and said, almost acknowledged, like, look, this isn't part of the good news, and that's okay. And here's sort of the ways we're going to help you get through that, and start by sort of educating. I think would have been really great. So that's probably what I would share.
I think that, like you said, everything happens so fast from the time of like diagnosis to treatment to, okay, like now you have finished treatment and you're in your like the first year of like post survivorship, from 5 years to even now 10 years. Like it's such, every, year and milestone is such a different like kind of trajectory. I would have been like 21 at my 5-year like survivorship meeting, like having a more like serious conversation, or just like a resource to be like, okay, even though you're 21 and you're going to graduate college soon and this may not be on your mind, these are things that from chemo potentially could have happened, or these are your numbers of where we're like at right now. Because when you first get your like treatment binder and it gives you all the descriptions, like it's like listening, like to a drug commercial.
Both of your points are really well taken, because I'm someone who has, like many oncologists, most oncologists, has a really vested interest in making sure my patients and their families have the information. But in the hustle bustle of like making sure the right labs are ordered, are the right images done, like checking off the list, talking about fertility, almost it feels awkward on my end.
Yeah.
Because I'm kind of introducing it in the midst of this, news of a new diagnosis. And oh, by the way, the treatments that we give can have this impact. And that's really helpful to hear, because I think a lot of oncologists struggle to say it in a sensitive way, but also in the grand scheme of everything. And, having great colleagues in reproductive endocrinology and infertility to kind of almost pass that baton to as the experts in that, I think has been really helpful in making sure patients get the information, like to your point, Joe, not necessarily everything from your oncologist, but from people who could answer more of those in-depth questions. So
Yeah, I think the multidisciplinary approach is where, we're heading with all this care, and just having it be open to you and having a way that people can hear it and be able to respond to it is, what we're hoping for.
Joe, I know you mentioned earlier that you wanted to talk about a little bit how awkward it was for you for the fertility testing process. So are there particular things that you'd like to say about that?
I was 21. I was a college student. I was a senior at University Park. And, it was sort of just all the stuff was thrown at me. I think, like I said, I was less concerned about fertility. Wasn't like the big shining light in front of me. I wanted to stay in school, which I did, and graduate on time, which I did. And so I had, there was actually not a facility in state college to go do this, sort of a reproductive, diagnostics place or anything like that. So I actually went to Pittsburgh. So I drove to Pittsburgh, and I drove by myself, and I showed up at this office building, and it's, I will say, the most sterile, dated environments I've ever been in have all been reproductive centers. If someone could just make one that was like built for this generation, it'd be amazing. But you go in, and it's like the person's like, "Why are you here?" And you're like, "What do you mean, why am I here?" Isn't there like one reason someone would come into this place? And so you're like, it's not like there's people waiting in a lobby, at least the places that I've been. And so it's sort of just, I'm probably going to say more than people need to know, but they give you the cup, and they're like, room 3 down the hall, and you go in, and I kid you not, this, very nice woman, but she wasn't exactly caring about my experience. She's like, put the paper towel on the seat if you want to use the seat, and there's magazines under the sink, and we'll see you in about 10 minutes. And I didn't know what to do. And so, I did the whole thing, and I come back out, and like that's just an awkward exchange when you give them your sample and got to write your name on it and all that stuff. And the people that work there, they're dealing with that every day, so they could really care less. They don't think it's awkward at all, but it is literally some of the most awkward times I've ever had in my entire life. And so I've like had that experience. It was like really sterile, and the person working there was like not very communicative, and that's one experience. I sort of later tested and sort of had hoped that maybe my fertility changed. And so when I moved to Columbus, there's a handful of places out here, and I visited them at the recommendation of my oncology team out here. Very similar experience, except the place that I've gone, I've done this 5 times. And so I did one time in Pittsburgh and 5 times out here, and all the times the test results were the same. But the place in Columbus was probably one of the 5 most beautiful women I've ever seen in my entire life. Was the receptionist, and was to this day one of the most awkward encounters I've ever had in my entire life, because she was so nice and chatty and trying to beat around the bush around what I was actually doing there. And so I decided one time that I went in there that I was just going to tell her my entire life story to like get it out of the way. And so it's just like the experience of it. You remove sort of the medical side and the testing side and the storage side of it, because there's a very sort of pragmatic, and there's a certain amount of things that need to happen in the experience. But the experience of, at least for speaking as a male, the experience of sort of reproductive diagnostic testing and all that stuff has just not ever been considered at the places I've been. And so there's no like, let's make you comfortable, let's make this not awkward. And there's so much opportunity for that, I think, in the experience. And I think, when you go to, great hospital systems, or you go to like a children's hospital, right? Like, when you step into a great children's hospital, like it's fun, there's colors, there's, toys, there's like all these things. Like, how do you think about healthcare in that manner, in like a full holistic experience from the minute you walk in? And I've just always thought that like all reproductive medicine has that opportunity to not feel sterile, because a lot of people do enter the space in a mindset that is not always so happy. And so I've just always thought it was a really interesting opportunity to, for healthcare to, deliver an experience around the medical experience that is, hopeful and optimistic and maybe a little fun. And so it's, those are my experiences. I'll leave it at that. I could talk for an hour about it, but I won't.
So I wonder, Joe, you said you got tested 5 times. Did you get tested that many times because you thought your fertility might change, or you found a partner that you could see yourself with for the rest of your life? And it kind of, as you were telling your story, I thought, well, yeah, like there is a difference between testing your sperm count as a result of a medical treatment versus testing your sperm count because you've met somebody that you want to build a family with.
Yeah. No, I did all my testing sort of without any immediacy towards family planning. It was always sort of, and I think it goes back to the education piece. I had talked to people who had said, there's really slim chance that it changes. And then I had talked to like one person who was like, well, I think like I read in some study that like it could come back. And so like I sort of, held on to that hope a little bit. And ended up sort of closing the door on it after the 5th time. And I think the other thing people don't talk about a lot is it's not cheap. Insurance doesn't generally cover it. And so you're paying a couple $100s, and, I was just out of college and didn't have a lot of money. And so, I ultimately stopped when I just decided like I was fine with, pursuing other options for family.
How about for either of our female panelists? Were there times of awkwardness as far as the procedures and testing that you had to go through?
Everyone has their own story and everyone goes through their own struggles. And I think that it's such a safe, like it always made me feel like a safe space where like I'm going through this, but someone else is also going through this as well. Um, it is such a roller coaster of like just up and downs. And I think that one, and I'm sure Dr. Estes could like attest to this too, is like your numbers tell a story, how you react to treatments another story, how, you know, it's literally like a day by day kind of what is happening like process. And um it can be, it truly is like a commitment of, okay, I know I'm getting my labs tested this amount of days, or I'm getting an ultrasound on these days. And I remember when I had started my injections, like the initial like just the bloat that you get, and I was just like, thank God for comfy yoga pants. And you're like the up and down of just like not only your emotions but your hormones as well. And I think that it like it takes its toll, and you have this end goal in sight. And even if you may not hear news that like you want to hear, I never felt like hope was completely diminished. Like I never felt like, okay, this is the end point. Like there are no other options. Like I've always felt so like, hey, this, and I think that's been my whole outlook even from when I got diagnosed, is this happened, but whether it's good or bad, it's like make like lemonade from lemons, like take the experience and take what this is, and we have X, Y, and Z plan that we can try.
But I think you bring up a good point, because it's just so difficult because it's a multi-step process and you don't know what the outcome is going to be. So, right, if you go to buy a car, you're like, okay, this is how much money I'm going to have. I'm going to finagle here and I'm going to then get this in response. And I think one of the most challenging parts about, what you may go through, and please, let me know, it's just, you don't know what's going to happen.
Yeah.
And then you have all these appointments and things that you're talking about, and it's very scary. So, I think we want to support people in this endeavor, and so anything we can do to do that better is in that multi-step process. And again, education.
Yeah. Like for my own story, like I have a low AMH count, which could like more than likely I can attribute it to chemo and everything like that. And when I had first started like fertility testing, like all my other levels were beautiful, like my uterus looked beautiful. I was like, okay, like this is gonna go great. And I remember like I got my labs after I was on like the birth control pills, and everything was great to start. And then kind of like starting the like injections, and I'm sure anyone that's gone through like fertility knows, like sometimes the medicine that you're on just isn't it for that round. And that was like hard to hear, but then it was like, okay, it's okay. There's still other options. There's like your body can still do X, Y, and Z. And I think it's very easy to feel defeated, and it's very easy to get caught up in this like, I don't want to say woe's me, because it's a very hard and difficult thing. And it is absolutely okay to like be sad about it and to feel angry about it. But I think it's a matter of like pushing forward through that. And if it wasn't for like the education and support that I got from like Dr. Estes and Dr. Butts, like I don't think I would have such like a positive and good feeling as much going forward through it. So like thank you so much to you guys.
I think we're touching on a little bit of 2 points that we wanted to talk about anyway, is like what are some of the very highs that you experience? What are some of the very lows that you experience? And like, how is that related to hope as you go through these processes? And I think like a little bit of what you were saying, and I'd like to hear more, is that kind of your hope shifts depending on what part of the process you're in.
That's almost like a mantra, like your hope shifts. Like, I remember I would have like a really great chemo week, and then the next week I had mucositis so terrible and I'm throwing up, and like I was like, this is the worst week of my life. And then it's like, no, that wasn't, in retrospect, that wasn't the worst week of my life. And your hope shifts. And I think that like I've always tried to have the mindset like I may be going through this, but someone else is also going through this. And I think that one of the biggest things with this panel is that like you're not alone, like someone can connect to you in some like way, shape, or form. And that like I think like that hope shifts. But I think just like that camaraderie and like even with like working with like the multidisciplinary team and everything, like that hope shifts, but you're never alone in like the ebbs and flows of that.
You go through so many ups and downs, like with any diagnosis. And, you know, Bemi, I'd be curious what you have to say, just like having such a long extended period of, you know, knowing your diagnosis and, you know, fertility and those things. But like, there's just so many ups and downs. It's sort of just, you know, the fertility piece is obviously just one part of it. I think when you do get into the fertility space, if you will, right, there's so many reasons for people that are having fertility challenges. It's actually like a really good reminder that like everybody's got something going on. And I think sort of is a really good mindset to just think about life, like, you know, and I'm a sort of a big believer, you know, everybody's always got something going on in their life. Like you've got to give people grace, and, you know, you got to give yourself grace too in those moments. And, but I think, you know, what was challenging for my wife and I, you know, when we did start to have conversations about family and all that stuff was, you know, you paint these pictures in your mind of what, you know, your little family is going to look like, or, you know, what life with, you know, having a child would look like. And, you know, you don't have that yet. And you start to see people in the world that do. And like, those can become like the hard moments that are very unexpected. You know, we went through an adoption process, and, you know, it's been amazing. And I've, you know, 5.5-year-old daughter. But there's you know, the adoption process is really tough. And there's a period where you're sort of just waiting. And you're waiting, like, and you're hoping for the phone call. And, you know, and then you hear about someone else that, you know, got matched, and, you know, they got to bring you know, their son or daughter home, you know, and you didn't. And like, so you feel out of control. And I think that's like a piece of the fertility thing is you feel really out of control. You can't really control it. You know, there's things you can do to inform it, but you really can't control it. And it feels like, even though I don't think this is necessarily true, it feels like people that don't have quote unquote fertility issues have more control. What I've learned over time, and sort of being on the other side of it now, is that I've yet to meet a set of parents that didn't have some sort of challenge. And it didn't always look the same, but like, you know, having a child, like going through the fertility process, is probably challenging for everyone. And it might be challenging at the beginning. It might be challenging, you know, in the middle, or, you know, might be challenging after, you know, the baby's born. But like, everybody's got their challenge. And it's just a good mental reminder that you're not alone. And, you know, something I've always tried to keep, to help myself sort of keep a level head.
It is not easy to have family building in any way, shape, or form. And so, you know, you alluded to the challenges in that way. And of course, it's worth it. And, you know, it is a great way to have a family. But I think also some of the ways that those around us approach things adds to the stress of the whole situation, because there are certain things, and people always seem like they can just comment on fertility. It's almost like touching a pregnant belly. It's something that is
Public.
yes, and people say things. And so I don't know if anything has happened in that regard to you all, but I would hope that we would be able to encourage people to stand up for themselves, and to be able to kind of have things ready to say if certain things happen, so that you can, you know that you are supported amongst being not alone in that situation.
A couple of things come to mind in response to what Joe was talking about, and some of what Corene had alluded to. Is it's almost like when you talk about it hits you when you least expect it, it's almost like a loss and a grief process until you have that resolution. Because like you say, you may not think about it for a little while, but then all of a sudden you see you know, X, Y, and Z friends having kids. And then it might hit you differently.
And along those lines too, with Corene, and Joe, what you said, it's like you're kind of doing that with two things, that life that you had of not knowing you had cancer and what the new normal is, like trying to navigate kind of similar yet different experiences at the same time. Yeah, that must be a lot.
Yeah, I was just gonna say for me, it's been more of a perspective shift because I actually always thought that I had the trait. It was only until my last appointment that I learned with using like a Penn diagram by my doctor that I don't only have the trait, but I actually have sickle cell anemia. So for me, it's been like, although I'm still young and I'm not really thinking about like family planning yet, but doing like the spaces and my when I have reflective thinking and thinking about my future, it does tend to put pressure on me, like on the fact that someday I need to tell someone that we might have fertility problems or that we're gonna have to like look for ways to maybe start a family in case naturally it doesn't work. But I do want to try to have it naturally first. I haven't done any testing yet or anything like that. But so it's just, for me, it's kind of scary because also too thinking about my little brother, although he's like only 10, that someday he's also too gonna have to go through all of this and, start talking and going through like what Joe said earlier, the awkwardness of having to do testing like that. So it's just a perspective change for me.
Dr. Estes started talking about like how people can be really insensitive um, in any really kind of situation that they're not sure what to say, whether that be a cancer diagnosis or a chronic illness or infertility. So I'm wondering if you'd be willing to share some of the most insensitive things that people have said to you, and if you have, something to suggest that maybe would have been a better alternative.
Yeah, I mean, I will say the adoption process is not dissimilar from people saying insensitive things. Um, I think a lot of things that sort of come to mind is actually dating is really interesting. So, like, you've sort of had many times, like, family planning has been mentioned, but the like big piece in the middle is dating. And like, I mean, the guy had testicular cancer is like the most awkward thing to talk about during the dating process. And I had gone on I don't want to say a lot of dates because, a decent amount of dates, an average amount of dates, and a responsible amount of dates. How's that? So, and I had had these like conversations with people, and some people didn't care, and some people thought like wanted to really dig into like the cancer piece or the fertility piece, and I would always at some point try to lay it all out there. And I had dates end like because it was very clear that that was an issue to somebody. So I've had dates that we just ended like in the middle of the date and went our separate ways, and it was all fine. And so I actually got really fed up with the whole thing at one point that I had decided the next girl that I took on a date, like I was just all on the table first 30 minutes. And it happened to be my wife now. And so, and she tells the story way better than I can, but like before appetizers even came, she got my entire story. And I was like, just to let you know, if like biological kids are important to you, we don't even need to order appetizers, like the whole thing. And we've been married for like 11 years now, so it worked out great. But it puts you in this really awkward position because until you say something, you feel like you're hiding something. Like you feel like you sort of have a secret. And for some people it's a really big deal, and for some people it's not, and you have no idea how to figure that out without telling someone. And so that, like, the dating piece to me was like the most challenging piece of the fertility, of having cancer, of the whole thing. And, people react differently to different things. And so you sort of can judge a lot by people's reaction to things. And there's a maturity level of, 22-year-olds versus 25-year-olds versus 30-year-olds that, spans a really wide gamut too. And I think, navigating any disease or sort of any traumatic event really in life matures you in ways that, not going through that might not. And so I've always found sort of the awkwardness and the inappropriate things for me always came sort of from the dating scene.
Kind of tying back to what Joe had said earlier about control, like whether it's like cancer, infertility, if I could have the control to not have, these things stacked against me, I would choose that. And I'm not saying everyone by any means does it on purpose. I don't think people necessarily try and be insensitive, but like until you're going through it, for someone to be like, well, you could adopt. Well, I could. And that is something that like, if it has to get to that point, you think about. But there's also this like, you're saying that, but imagine not being able to like have your own biological child. You're dealing with that. Like you're saying, well, you could do this, but in turn, I'm giving up this. And I don't think that people who are necessarily going through it like think about that aspect.
Like the incidence of people having difficulty having children is not low.
No, I mean, it's now we say 1 in 8 couples have
Wow.
challenges. And then other things, of course, with a different type of diagnosis, yes, would put you at least 1 in 3. So
Right.
it is extremely common.
Yeah.
So I haven't really encountered it, but I could say that a little bit of it could be from my own self, being insensitive to my own self. But like saying stuff like, okay, I want to adopt, but then I really want my own kids biologically and be able to start my own family biologically. It's just, I think also to just giving myself some grace and knowing that although it's I can't really speak much on it because I don't really have a lot of experience. So I just think mostly just giving my own self grace and also to spreading awareness of the fact of sickle cell anemia to the people that I am with and trying to educate them on it, which is something I am learning a lot. My sophomore year in college is on the aspect of just educating other people and like trying to help them understand. So maybe hopefully I can do that someday.
If you're choosing to like go through fertility, I feel like you're going through it either, for yourself to think like, how is this helping me to plan for the future? Or you're doing it with a partner for how is this helping us plan for the future? And I think for me, I had similar situations to Joe. And like I had a rule essentially where it was like I would ask someone 3 things about themselves, and then I would say 3 things about myself. And the fact that I had cancer was always one of those things. And like funny enough, my boyfriend Andrew, like I remember it was literally the first day we were talking, and like we're both in our 30s and talking about like, do you want kids one day? And I remember I was just like, oh, that's a loaded question, and sent him a novel of like, I would love to be a mom one day. I've always loved kids. But I've kind of put up this wall of I would love for it to happen for me. But if it doesn't happen for me because I had to go through something that, like I got medicine that had saved me, but at the same time could have caused so many things. It was just like an important conversation for me to have, essentially, to like weed out who could like go through this with me. And I actually remember one of the Life on Pause podcasts, like one of the things I said was like, who could I picture like pushing my kid on a playground set, like in the backyard? And I think that like, that's always something I've taken into like major consideration when like dating or being with someone. And my boyfriend, Andrew, and I, who like, we're in a very committed relationship, like, still waiting for something on my left hand, but we'll get there. So we can talk about babies, but not a ring. But I think it was a very like, I'm so thankful that he was so open and so like, okay, if this is what we need to do, like I'm on board. I'm always here to support you. Like it's you and me. And I think that that's very important, is having just like that support system from your partner, or even for yourself, because it's something that like, even though like I was the one taking like the medicine and I'm the one that's doing a majority of like X, Y, and Z for like my eggs, and like it's like Joe had said, it's not like it's easy to just walk into a room and be like, okay, well, here you go, like see you in a couple minutes. And I think that for as much as like I'm going through it, like he's going through it too. Like he's the one that is, when I'm at 20%, he's at 80% picking me back up. And I know that regardless of like where this journey goes, a big reason like while I'll be okay is because like I know I have him.
I never once had, anyone sort of who was inquiring about how I was doing through treatment, cancer, the whole thing, ever ask about fertility. I think because I think it is a taboo topic. I think maybe at 21, not a lot of people were thinking about it as well, but, and maybe it's something that, more people might ask about or inquire with friends who are female, but, I've sort of shared with some of you before, like I think it's taboo among men a lot of times to talk about fertility. And I also think more men than people realize struggle with fertility issues for a number of different reasons. And so I do think it's something that's okay to ask your male friend and, inquire about it and be curious about it. But I think conversations like this go a long way. I think, reflecting on like my parents, and how they felt about it. And my dad was adopted also. And so that was like an interesting wrinkle in the entire story, because my grandmother had fertility issues and couldn't have biological kids. And so my dad and my aunt were adopted. And so adoption has always sort of been a part of my family story. And I've always known growing up, my dad was adopted. But, there's a lot of ways to make a family. There's no right way to make a family. And, I can sort of tell you from the other side that, it's great being sort of a dad and having this adoption experience. For anyone that is listening that, adoption's of interest, I think one of the best things we ever did was we actually found a pediatrician who adopted kids herself. And we spent a lot of time trying to find a pediatrician that would understand our situation or be a little more empathetic to our situation, because there's a lot of questions and things that come with that you don't necessarily think of, where you don't have you don't go through the pregnancy experience. And so there's a lot of things you just don't learn along the way. But I think conversations like this are great. I think the multidisciplinary approach to medicine is where a lot of great health centers are moving towards. And there's a reason for that. And so more people involved, the better. More coordinated care, the better. And it was mentioned earlier, but like to not put all the pressure on the oncologist or one person in the room, I think is a very real and powerful thing. Because, you want your oncologist focused on sort of a singular thing at times. And it's a big burden for one person to have to deliver all of those news and educate all of those things. So, I love the way healthcare is going. And so I just say I appreciate having this conversation, and thank you for having me. It's been great.
For me, I don't know if maybe it's just being in nursing school. So it's just all about raising an awareness and educating people from early on the problems that, well, not problems, but like on the extra, like, I don't know how to describe it, I'm sorry, but like there is more to it than just the surface of your diagnosis. And I just raising an awareness and informing people, and while doing that, being there along the way to help and to guide them. It could be just like family and the interdisciplinary team, because we've been talking about that also too in school, and it's been really eye-opening how different professions can come together and form a ground base for individuals who have different diagnoses, and also to help individuals with their fertility issues, and letting them know that it's not just them, that there's someone who is there backing them up and supporting them.
You three are doing just that. Like you're doing such wonderful advocacy, even if you don't realize it, by talking about your experience. So really want to thank you three for really opening up about really personal things so that others have that benefit of that knowledge, myself and providers included.
Yes. Yes, thank you so much for being vulnerable and for sharing, things that really matter.
Thanks to everyone for attending and our panelists and everyone that made this webinar possible, including divisional support from hematology oncology, pediatric hematology oncology, reproductive endocrinology and infertility, and 4 Diamonds. Thanks.
Thank you.
Bye, everyone.
Bye.
Bye, everybody. Thank you.